Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Birgit Tans and Paul Sessink about safe handling of hazardous medicinal products, in particular what the guidance says and how this is translated into practice. Could you start by introducing yourselves?
My name is Paul Sessink. I'm a chemist from original start with my studies. And later on, I started with a PhD study sponsored by the Ministry of Social Affairs in the Netherlands on hazardous drug exposure. And I got that PhD in 1996. And later on, I started my company Exposure Control based on all the studies we have done. And that company is still running, and we do a lot of monitoring around the globe for hazardous drug exposure.
Okay, my name is Birgit Tans. I'm a hospital pharmacist in the University Hospitals of Leuven in Belgium. I worked there for 37 years now, from whom about 30 years I'm responsible for the toxic products and especially in the compounding material and also everything that has to do with spillage and safe handling.
And can you each give us a brief overview of your role, what your current job involves?
We do already many years monitoring studies in hospitals, mainly to check exposure or contamination. And that's based on surface wipe testing. We have a kit to check the environment, whether or not there is contamination. We send it to the customers, to the hospitals. They do the checks themselves, and we send the samples to our laboratory in the Netherlands, where we do the analysis, and then I make a report with results and recommendations. And we have done this already in about 350 hospitals in the world over the last years. So that's the main thing we are doing. And nowadays, or at least recently, we changed also to add antibiotics to this group of drugs. So it's not only the hazardous drugs, but also the antibiotics, because we consider that a lot of exposure is happening with antibiotics, and people really get upset because they think they can be sensitized to these antibiotics. And so that's another topic we are focusing on. So that's what we offer customers, and we do actually the analysis. We explain the results and we give the recommendations to improve their safety.
I am part of the compounding team of our hospital. This means semi-industrial preparations and also for patients preparations. But my specialism is the cytotoxics and other potent or hazardous drugs, especially then the compounding part and also everything that is involved in safe handling and spillage and other things that has to do with hazardous drugs.
Now, you ran a joint workshop at the JERPAC Congress on safe handling of hazardous medicinal products, and this is what I'd like to focus on in this interview. But my first question is, what are we talking about here? What is a hazardous medicinal product?
Well, it's very strict described what it is, and it's also the guidance is really focusing on HMPs, hazardous medicinal products. That means that all drugs that are either carcinogenic, either mutagenic, or either reprotoxic are HMPs, hazardous medicinal products. So it should not be all the three parts of it, not all three, but if one of the three is available, then it's considered as a hazardous medicinal product.
Mm-hmm. And why is the handling of these products an issue?
That's a good question, and it was also what I asked myself. The issue is that there are many European countries who have already their guidelines on safety when you handle hazardous drugs. But not all the countries are on the same level. There are big differences between member states, and there is a growing concern that I would say there are about 3-4 million people working with these drugs daily, that this could have an adverse effect on their health on the long term. And so there was a need for a European view on guidance, which would enable countries who are a little bit back to progress, to make steps forward, and to come at a certain level where we would say, well, this is a good practice level. And because there are so many studies published how to do this and so on, and different ways, different approaches, there was a real need said by the people who work with these drugs. We would like to have a guidance document that helps us making steps forward. So finally, the European Commission agreed after many years to have this guidance document. And this guidance document actually shows the need that people get aware of the risks when they are handling hazardous drugs and how to manage and control when they handle the drugs. So they give recommendations, they give advice how to proceed when you are daily working with these drugs. And that means not only from pharmacy side where you have the preparation, but it's also nursing when it is about administration. And then, of course, you have the waste, the cleaning, and all these other jobs that are related to potential exposure to hazardous drugs. So that was actually the basic behind the guidance, and it ended up in a big book, which is, it's not easy to read, I must say, but there is a first step in the guidance which showed that if you go to that table, it is showing you which sections of the guidance is relevant for your job. For instance, when you are a pharmacist, you have to read maybe 4 or 5 sections of the whole guidance which are relevant for you. So it's very helpful to use and to apply in daily practice.
I see. But how can I tell if a medicinal product is hazardous? Where would I find the information?
There is information available nowadays. For instance, in the United States, you have the NIOSH document, which lists a lot of drugs that are hazardous to people, to workers. There are also within Europe lists in several countries. So there is already information available on paper, but also there are data files where you can find this information. So if you want to know if a certain drug is hazardous, then you can find it there. But there are, of course, drugs who are not on the lists, and that makes that you have always to be aware that there is a potential risk for these drugs to be dangerous, hazardous for you. For example, we have to deal with investigational drugs that are not on the market, but are used in clinical trials, who can be very dangerous. So there is always a lot of information available, and if it's not there, then the producer of the hazardous drug should provide you with that document. So you can find it, but it's mostly not so easy to find the drugs that are not so frequently used. So that's more complicated. But there are list databases available.